This is now the third day going into the night for a strike for nurses at Providence, Portland, St. Vincent, and Seaside. And KOIN 6 breaking down the situation in dollars and cents. Thanks for joining us for KOIN 6 News at 5. I'm Elizabeth Din.
I'm Jeff Gianola. We want to know, as nurses say they're being paid below market value, how much money does Providence Health and Services have to pay them? Brandon Thompson digging deeper into this. He's live along the picket line at Providence, St. Vincent. Brandon?
Well, Jeff and Elizabeth, Providence, to put it simply, is not in the best financial situation right now. It lost more than $1.5 billion last year, but the nurses union says, look at the executives. The CEO makes around $10 million. Several other executives make 7 figures, and the nurses say those aren't even the people keeping patients alive.
Hey, hey, ho, ho, unsafe staffing has got to go.
Nurses on the picket line for day 3. Before the strike began, Providence offered a contract that would increase pay $35 million in the first year compared to the last contract. But the Nurses Association says it did not pay all nurses at the same range and does not make up for paid sick time the hospital system had cut. Providence has over $26 billion in assets, but since the end of 2021, it has been in a precarious financial situation. Providence faced a $1.7 billion operations deficit last year, though there are signs the bleeding is slowing. Through the first quarter of last year, Providence was over $500 million short. Through the first quarter of this year, it's short $345 million. Revenues last year increased 8%, but pharmaceutical and medical equipment costs increased 13%. And labor costs were up 5% as the hospital relied more on contracts with staffing agencies versus staffing employees because of the labor shortage. The hospital system was not alone, as the Oregon Association of Hospitals and Health Systems report 63% of hospitals in the state are facing deficits in their operations.
When you see sustained losses like that over such an extended period of time, hospitals are really going to be forced to make difficult decisions.
The Oregon Nursing Association points to executive salaries as one area to fund the increased pay for nurses. CEO Rod Hochman leads all earners at Providence, according to several reports, with a salary between $9.5 and $10.5 million. The next highest earner makes around $3.5 million. Several reports tally there are between 19 to 26 executive employees making at least $1 million. Providence does not dispute these numbers. In a restructuring plan announced last summer, Providence says executive positions would be cut in order to focus on recruitment and retainment to limit the reliance on staffing agencies.
Because there is a nationwide workforce shortage, hospitals have had to rely on outside agencies to fill needed positions.
So Providence did get back to us with more details on its restructuring plan, saying that many of the executive positions are not being filled after people leave or retire or otherwise. Now, we also wanted to know, what is the difference between what a nurse on staff makes versus a nurse from one of those staffing agencies? Providence says that varies on the market and the demand, but nurses on the picket line say travel nurses and nurses from staffing agencies make significantly more. A reminder that Providence does not negotiate during strikes, so nurses will be on the picket line through Friday. Reporting live in Southwest Portland, Brandon Thompson, KOIN 6 News.
Yeah, all good questions you're asking there, Brandon. Thank you.